You know that feeling, right? You go to the doctor, maybe you have a test done, and then like weeks later, the envelope shows up. You open it, and there it is, the medical bill. And for most of us, it just looks like a confusing mess of codes and charges. Feels totally opaque. How they even arrive at that final number can seem like a mystery. But behind that bill, there's actually this really fascinating, pretty intricate system humming along. So today we're going to take a deep dive into, let's call it the engine room of that system, medical billing. And we're specifically focusing on two really essential pieces, coding and scrubbing, often overlooked but critical. Our goal here is to sort of demystify how what your doctor does gets translated into those claims and, how healthcare providers try to make sure they get paid accurately and quickly. This whole discussion, just so you know, is based on insights from excerpts from medical billing, coding and scrubbing for revenue cycle successes. Think of this as your shortcut to understanding a really vital part of how healthcare actually works. Okay, let's unpack this then. What exactly is medical coding when we talk about healthcare?
Right. So medical coding, basically, it's the process of translating everything a provider does, the diagnoses, the procedures, the services, into standardized codes, like alphanumeric codes. Think of it as a universal language. It's how providers talk to insurance companies for billing.
A universal language, okay.
Exactly. And the main purposes are, well, first, making sure everything's documented accurately, every single service. Second, it standardizes that communication with payers so everyone's on the same page, which helps things move smoothly. And there's another layer, too, something people don't always think about. These codes, they're not just for billing. They actually form the backbone of all our public health data.
Oh, interesting. How so?
Well, accurate coding gives us this real-time picture of things like disease prevalence, how effective treatments are, where resources are needed. I mean, imagine if something simple like, say, the flu gets miscoded consistently across the country. Suddenly, our national health stats, research funding, public health plans, they could all get skewed.
Wow. Yeah, that's a huge impact from seemingly small details.
It really is. Hidden in those codes.
So you mentioned it's like a language. Does that mean there are different types of codes, like different categories? Can you give us a feel for those main types?
Absolutely. There are a few key sets you see all the time. First up, you've got ICD-10-CM codes. These are purely for diagnoses. They answer the question, what is wrong with the patient? Like E11.9 might mean type 2 diabetes without complications.
Okay, the what's wrong. Got it.
Then you have CPT codes. CPT stands for Current Procedural Terminology. These describe what was done to the patient, especially for outpatient services. Like 99213 is a common one for an established patient office visit.
The what was done. Makes sense.
Then there's another set, HCPCS Level 2 codes. These are often for things outside the direct physician service. Think medical supplies, wheelchairs, ambulance rides, things like that.
Right, supplies and equipment.
Exactly. And finally, and these are super important, you have modifiers. Think of these as little additions to the CPT codes that add crucial detail or clarify the circumstances.
Modifiers, like adding a note.
Sort of, yeah. For example, a modifier might show that a separate evaluation was done on the same day as a minor procedure. Without that modifier, the insurance might just deny the evaluation, thinking it's bundled into the procedure fee, even when it wasn't. They provide essential context.
It definitely sounds like some real detective work for the coder.
Yeah.
Let's say someone comes in for just a regular checkup, but during the visit, the doctor spots something new, maybe diagnoses high blood pressure for the first time. How does the coder capture both things properly?
That's a perfect example of the complexity coders handle daily. It starts with them needing to really meticulously review all the documentation. They're looking at the doctor's notes and the EHR, the charts, lab results, everything.
Okay, deep dive into the notes.
Right. Then, from all that information, they identify the specific diagnoses and all the procedures or services that were actually provided during that encounter. After that, they grab their coding manuals, or more often now, specialized software, and they assign the correct ICD codes for the diagnoses, like the high blood pressure, and the CPT codes for the services, like the office visit itself.
And the modifiers if needed.
Exactly. They'd apply any necessary modifiers to clarify things, like maybe that evaluation led to the new diagnosis during a preventative visit. And the last step, which is critical, is checking for coding compliance. They have to follow all the rules set by the specific insurance payer and federal guidelines, too. They need to avoid upcoding billing for more than what was done and also undercoding, not billing for everything they should have.
So finding that sweet spot.
Precisely. It's about accuracy and compliance. It ensures fair payment, yes, but it also avoids those dreaded audits and keeps the practice financially healthy enough to provide care.
Okay, so coding lays the foundation. You get the codes right.
Yeah.
But you mentioned errors can still happen. What's the next safety net? What happens before that claim actually goes out the door to the insurance company? Here's where it gets really interesting.
That's where claim scrubbing comes in. Once the codes are on the claim form, scrubbing is that crucial final check for errors before it gets submitted.
Scrubbing, like cleaning it up.
Exactly. Its job is vital. Detect and correct any coding errors, formatting mistakes, missing information, anything that could cause the claim to be rejected or denied by the payer. The ultimate aim is to maximize what we call the first pass acceptance rate.
First pass acceptance rate.
Yeah, basically getting the claim accepted and paid on the very first try. No rejections, no delays, no back and forth. That saves a ton of time and money.
Makes total sense, like proofreading a critical email before hitting send. So how does this scrubbing actually work? Is it just someone carefully reading every line, or is technology involved here? I imagine it has to be tech, right?
Oh, technology plays a huge part. It's really the first line of defense. Most practices use automated scrubbing tools first. Software platforms, you might hear names like Claim Scrubber, or functionalities within systems like Availity automatically scan the claim for a whole checklist of potential errors.
What kind of errors can software catch?
All sorts. Things like invalid codes, codes that just don't exist anymore, or missing codes entirely. It checks for inappropriate code combinations, like trying to bill for two procedures that logically couldn't happen at the same time. It flags gender mismatches for procedures, like billing a hysterectomy for a male patient, or age mismatches. It looks for incorrect modifier use or diagnosis codes that don't medically justify the procedure code used. Even simple typos, like a wrong digit in a patient's date of birth or a provider's ID number, can get flagged.
Wow, that's pretty thorough for an automated check.
It is, but it's not foolproof. So if the automated scrub flags a potential issue, that's when manual review kicks in.
The human touch.
Exactly. A skilled billing specialist takes a look at the flagged claim. They'll investigate the error, make corrections. Sometimes they even have to go back to the original doctor's notes to clarify something. Then there are also compliance checks, making sure the claim follows all the specific rules of that particular insurance company, plus broader rules like CMS guidelines for Medicare and Medicaid, and of course, IAPA privacy rules.
Right. Gotta follow the rules.
Absolutely. Only once it passes all those checks, gets corrected, and is verified as a clean claim is it finally approved and submitted electronically to the payer.
It sounds like these scrubbing tools must catch some pretty common, maybe even surprising mistakes then. What are some of the usual suspects?
Yeah, you see some recurring themes. Definitely incorrect diagnosis or procedure codes are common. And those incompatible code pairs I mentioned, billing for two things where one is included in the other or they're mutually exclusive.
Like billing for taking out an appendix and then also billing for an appendectomy separately?
Kind of, yeah. Or things that are components of a larger procedure billed separately when there's a single code for the whole thing that's called unbundling, and it's a big no-no.
Okay.
We also see, surprisingly often, missing NPI numbers, the National Provider Identifier, or just basic missing patient info like date of birth or insurance ID. Simple stuff, but it stops a claim cold. And incorrect use of modifiers is another frequent flyer. Getting those wrong can easily lead to a denial. It's this constant process of catching errors, whether they're simple typos or complex coding misunderstandings.
So coding gets the information right initially, scrubbing cleans it up for submission. After all that effort, all that precision, what does getting this right actually mean? For the practice, sure, but maybe for the bigger picture. For us as patients.
Oh, the impact is huge, and it definitely flows down. For the healthcare practice, accurate coding and thorough scrubbing mean, first and foremost, increased accuracy. Fewer mistakes mean fewer rejected or denied claims.
Which means they get paid faster.
Exactly. That leads directly to faster reimbursement, better cash flow. That financial stability is critical for a practice to keep its doors open, invest in equipment, pay staff, and ultimately provide better care. For you, the patient, that might mean less confusing follow-up bills or calls about denied claims.
Makes sense. What else?
Well, it's crucial for legal and regulatory compliance. Doing it right dramatically reduces the risk of audits from insurance companies or government agencies, which can be incredibly costly and time-consuming, sometimes resulting in huge fines.
Avoiding trouble, basically.
Right. It also ensures optimized revenue, making sure the practice is capturing the full, fair value for the services they actually provided, not leaving money on the table due to errors, but also not overcharging. And finally, consistently sending clean, accurate claims helps build enhanced payer relationships. It fosters trust between the provider and the insurance company, which can sometimes smooth out other administrative hurdles down the line.
Okay, so it really touches everything from cash flow to compliance to relationships. Given how complex this sounds, and the sheer number of claims practices handle, what's the technology powering all this? What are the tools they're actually using?
Yeah, they absolutely rely on specialized tech. For the coding part itself, there's sophisticated coding software. You hear names like 3M, TrueCode, Encoder Pro, Optum 360. These tools help coders find the right codes and stay updated on the constant changes.
And for the scrubbing.
There are dedicated claim scrubbing platforms. Companies like Availity, Change Healthcare, Waystar offer robust scrubbing solutions that integrate those complex payer rules and edits. And increasingly, what you're seeing is EHR-PM integration.
EHR, electronic health record. PM is practice management.
Correct. Systems like Athena Health, Coreo, Dr. Chrono, and many others are building these coding assistants and claim scrubbing features right into the main software the practice uses every day.